This video is brought to you by MD Anderson Cancer Center at Cooper.
Hi, I'm Ike Reese, and I'm here with Dr. Jeffrey Tomaszewski with the MD Anderson Cancer Center at Cooper Urological Cancer Program. How you doing, Doc?
I'm great. Nice to meet you.
All right, Doc, we're here today to spread the message of just how important it is to get a prostate exam. And as an African-American male myself, I know I'm at a higher risk for prostate cancer, which is why it's recommended that African-American males start getting screened at age 45. All right, Doc, we've received some great viewer questions about prostate cancer, so let's get started with some of them.
Great.
First of all, people want to know, what is prostate cancer?
Right, well, the prostate is a gland or an organ that lives sort of down in your pelvis between the bladder and the penis. And when abnormal growth occurs within the cells in the prostate, just like any other organ in your body, it can develop into a cancer of the prostate. So it's really, plainly defined as an abnormal growth of the cells within the prostate.
Yeah, and how's it diagnosed?
Well, typically, most men with prostate cancer don't have any symptoms, which is why it's so important to be screened for the disease. It's usually diagnosed by either a blood test called the PSA, or prostate-specific antigen, and/or digital rectal exam, which is a digital rectal exam, or the rectal exam, which is actually when your doctor feels the prostate in the office.
Now, the all-important question, what causes prostate cancer?
Right, that's the great question, and the answer is a lot of things, and it really comes down to mutations in the DNA that cause abnormal cell growth. And some people may be more at risk for those mutations in their DNA than others, and it's important if somebody in your family has had prostate cancer that you could be at a higher risk. Likewise, African American men, as you already alluded to, are at almost a twofold increased risk over other ethnicities, and they need to be screened even more frequently and earlier than other races. So there's a number of causes, some of which we're not entirely sure within the environment, things that may or may not cause prostate cancer, but the risk factors we know for sure are race, obviously being male, as females don't have a prostate, and family history.
Yeah, and when should men begin to get screened?
Yeah, so the screening guidelines have changed a lot over the last couple years, and there's been a lot of controversy even recently about when to get screened. And in general, for men at high risk, so if you have a first-degree relative like a father or a brother with prostate cancer, or if you're African American, you should talk to your doctor about screening starting at the age of 40. If you don't have those risk factors, then screening really starts at the age of 55 until about 69. So between 55 and 69, most men should be screened. Once you hit 70 and above, only really select people should undergo screening at that point. And if you're, as you know, not every 70-year-old is created the same. So if you're a very young, healthy 70-year-old, there may be a benefit to screening. But if you have a lot of other medical problems, sometimes we don't need to screen for prostate cancer anymore once you hit 70.
Now, do I need to see a specialist for this?
No, you really don't. You could see a specialist if you want. Some men choose to do that. But you can also have screening done by your primary care doctor. And that's a great first place to start because they can do the rectal exam, you feel the prostate, and order the blood test as well.
And what's a Gleason score?
Yeah, so the Gleason score is a confusing term, and it's something you hear of if you are diagnosed with prostate cancer. Okay, it's how the cells look under the microscope. And basically, the Gleason scoring system ranges from 6 to 10, very simply, and it's a marker of how aggressive the cancer you have is. But you'll only be assigned a Gleason score if you've been diagnosed with cancer. If you don't have prostate cancer, you don't have a Gleason score. So a lot of guys get confused about it, but it has to do with how they look under the microscope.
Now, I heard PSA level is important. What is exactly prostate-specific antigen?
Yeah, good. PSA is a blood test, and it's a protein that's only made by the prostate. So if it's elevated, that could indicate a problem like prostate cancer or other things, an enlarged prostate, which is not cancer, or inflammation of the prostate. So a PSA is really a screening test. It's a tool we use to help detect the prostate cancer, but it's not 100% specific for cancer. So even if your PSA is elevated, does not mean you have cancer. And if it is elevated, you need to get evaluated to find out why it's elevated. but it's one of the tools we use to screen men or to try and find cancers that don't have symptoms otherwise.
And along with the PSA test, how reliable is that test along with the digital rectum test?
Yeah, so when you put the two together, they're actually pretty good at detecting cancers. Some of the problems with PSA that we've run into is that it tends to over-detect cancers, meaning a lot of these cancers with the prostate that we'll talk about are slow growing and may not even require treatment anymore. So if we detect too many of those and over-treat men, there'll be side effects of treatment. So the goal is really, the PSA test is what you do with the test, right? It's a good test, but it's not a perfect test. It's what you do with that data that's most important. So taking that data and then deciding correctly on how to move forward once you have an elevated PSA, whether or not you need a biopsy, and then what kind of treatment you need, that's really what it's all about.
Well, you mentioned needing treatment. What are some of the treatment options?
Right, so luckily for a lot of men with prostate cancer, the prostate cancer is a slow-growing disease in general. So it doesn't mean we don't want to find it, we still do, but for a lot of men, we can watch now. For men with low-risk prostate cancer, or the type that is not very likely to grow quickly, we put people on active surveillance, where we actively monitor the disease and make sure it doesn't progress before we miss our window for cure, okay? So active surveillance has become really one of the frontline therapies we use for prostate cancer. And it's not doing nothing, but it's watching and intervening when it's appropriate. The other treatments broadly are surgery, where we remove the prostate, and radiation, which is basically putting you into a machine that delivers radioactive beams to the prostate to kill the cancer cells.
And the thing that concerns us when you get treatment, the side effects.
What
are some of the side effects of the treatments?
Yeah, of course. So,
if any.
Of course, right. So the beauty of using surveillance when appropriate is there really are very little side effects of watching, right? So we can delay the side effects for many years for most men. But when you do need treatment, there are side effects. And unfortunately, no matter what treatment you use for the prostate cancer, it can affect your sexual function, so the erections, which every man cares about, and the urination. So those are the two big side effects. Luckily, our modern treatments have gotten much better, and so we can minimize a lot of those side effects, and we have great treatments for the side effects. So a lot of guys avoid getting tested or checked. They don't even want to know they have cancer because they want to avoid the side effects of treatment, but realize that a lot of the side effects are manageable and much better than they used to be.
Mm-hmm. And the chances that by going through these treatments that the prostate cancer will be cured, what are those chances?
Right, and so obviously every case is different depending on what kind of cancer we find, how aggressive it is, when it's found, but when caught early, which is why we advocate for screening, most prostate cancers are still curable. And you can continue on with your life despite having prostate cancer for many years. So chances for cure with prostate cancer when detected early are excellent.
Are there other conditions that have symptoms like prostate cancer?
So sometimes men with an enlarged prostate, so for us men, as we age, our prostates grow. That's normal. And as it grows, it can impede the flow of urine out of your bladder. So that can cause urinary symptoms, such as burning when you urinate, a weak stream, frequency to urinate, or urgency to have to go all the time, or even blood in your urine. These symptoms can sometimes parallel that of advanced prostate cancer. So if you have urinary symptoms, that's no longer screening. You need to see a physician to be evaluated to decide if this is something worrisome like a cancer or just healthy enlargement of your prostate.
Mm-hmm. Now, are there genes that put me at a greater risk of getting prostate cancer?
There are, and in general, prostate cancer is viewed as sort of a multifactorial cancer, meaning there are a lot of different factors that make one guy have a cancer versus not. We think that about 10% of prostate cancers have a heritable component, meaning something from your family or at your genetic level was altered. Genes like BRCA, BRCA1 and 2, which you've probably heard of from breast and ovarian cancer, are also abnormally mutated in some prostate cancers. So there are certainly genetic factors predisposing some men to prostate cancer and certain genes that are abnormal, but not every man will have these mutations. And the majority of prostate cancers are spontaneous, meaning sporadic or random mutations at the genetic level cause the cancer.
Mm-hmm. Now, as a guy like myself, I still work out a little bit and I use dietary supplements at times. What role does your diet and dietary supplements play in getting prostate cancer?
Yeah, that's a great question and one we hear quite a bit. So most men use some type of supplements or have different dietary schemes they do as part of their nutritional or workout program. So from a supplement standpoint, we know that in general they're probably safe. the things we know that may put you at increased risk, we don't know definitively, but if you eat a diet that's too high in dairy fat, so if you eat a lot of ice cream, for instance, and way too much, or if you eat a diet too high in animal protein, so you don't want to eat hamburgers every single day, right? For a lot of reasons, right? I'm sorry, you're going to have to change your diet now, right?
I'm sorry about that.
But those things can put you at a slightly increased risk of prostate cancer. So aside from that, a lot of the dietary things that apply to a good heart and kidney and otherwise healthy lifestyle apply to cancer as well. So eating foods that are, low in saturated fats, good proteins, lean meat and fish, right? Those things are all healthy for you. Things high in antioxidants help. But there's no single thing in your diet or supplement you can or can't take that will adversely affect the prostate. Generally, if you exercise and lead a healthy lifestyle, it helps reduce your risk of all types of cancer, including the prostate.
All good information. Well, that concludes our chat for today. Thank you, Dr. T.
Thank you. It was a pleasure.
Very gracious of you answering all of our questions. We really do appreciate it. If you would like more information on the Cooper Urologic Program, please visit cbsphilly.com/CooperDocs.
This video is brought to you by MD Anderson Cancer Center at Cooper.